So most people become eligible at age 65 for Part B. But if they continue working and have group insurance or other benefits, they may delay enrolling in Part B until a later date. Now, Part B does have a monthly premium, which starts at $144.60 per month, but that could be higher depending on if you have a higher income. That premium is typically deducted right out of your Social Security benefits. If you're not receiving Social Security benefits yet, then you can set it up to be paid directly to Medicare. Medicare Part B works with any doctor or facility that accepts Medicare nationwide. So there's no network, and it's almost 1 million providers now, or just over 1 million that accept Medicare. So someone with Medicare Part B coverage only would have a deductible when they go to doctors or outpatient facility or other lab services, etc. A once per year Medicare Part B deductible of $198. And after that deductible has been paid for the year, Medicare pays 80% coinsurance. So the beneficiary is then responsible for the other 20%. Some doctors, though, can choose not to accept Medicare assignment, and they may charge what's called an excess charge, and that's 15% above what Medicare would have paid that doctor if they had accepted Medicare. So along with Medicare Part B, there's no maximum out-of-pocket or cap. So let's say, for example, a $100,000 outpatient cancer treatment. Medicare would pay 80% of that, Part B, but the beneficiary would still be responsible for 20%, which would amount to $20,000 out of pocket for a $100,000 treatment just in that scenario. So now that we understand the basics of how Medicare Part A and Part B work, the next question to ask ourselves is, how will we receive our Medicare benefits? So there's two ways to really go about it. Option one would be original Medicare. If you're looking at the chart here, on the left is what you would have with original Medicare. So you would have your Part A, which is your hospital insurance, your Part B, which is your medical insurance, and you would have a Medicare supplement or a Medigap policy picking up the difference for most of the difference. And then you'd have a Part D prescription drug plan for your prescriptions. Now, this option on the left, option one, can get a little pricier or on the pricier side, but in some cases, you can have a majority of your out-of-pocket expenses covered. Now, option two, which is going to be on the right side of this chart, is a Medicare Advantage plan, also known as Medicare Part C. So most, but not all Medicare Advantage plans include prescription drug coverage. Look at Part C as a combination of Part A, your hospital benefits, Part B, your medical benefits, and Part D, your prescription drug coverage, all together in an all-in-one plan. Now, they're designed to provide benefits equivalent to original Medicare, and most Medicare Advantage plans include extra benefits that option one, which is original Medicare and Medicare supplement plans, for example, don't offer. But one of the key differences is that they actually have a maximum out-of-pocket limit each year, and that can be as low as $0 up to a maximum of $6,700 per year, depending on the plan. All right, so let's look at some important facts on Medicare Advantage prescription drug plans, or Part C.